Hi, this is Dr. Patel. Thank you so much for joining me on this video. This presentation was given at the Gluten-free Expo in Toronto. The title of my talk is Functional Symptoms of Gluten Intolerance and the Implications. I'm going to be talking about some advanced topics when it comes to gluten for the lay public, but I think these are very important when it comes to maximizing the benefits that you get from going on a gluten-free diet. We're going to be discussing things that you may or may not have heard of, so I decided to put them in a video for you so that you can review this after watching me speak live. I hope you find this extremely beneficial, and I hope you can share this with others who you know need the help. I'm a functional medicine provider, which I'll be talking more about a little bit later. I'm also a certified gluten practitioner and founder of the Living Proof Institute, where 100% of our protocols clinically are gluten-free. Not only am I gluten-free personally, but my entire family is, and gluten has affected me in a significant way for the better half of my life. And a few years ago, when I discovered I was gluten sensitive, not celiac, I realized how gluten was affecting me. And since then, by removing it from my diet completely, I've noticed tremendous health benefits. So I applaud you again for joining me on this video, and I know you're going to learn a lot. At the end of this video, you're going to get a few bonuses, and you can also contact me via email in case you have any questions. So the topics we're going to cover today, the first thing is, what is functional medicine and how can it help those suffering from gluten-related issues? Number two, what are the clinical signs of gluten-related issues outside of the gut? So gluten not only affects the digestive system, but it also affects other systems in the body, such as the brain, the skin, and what you'll see, the immune system. Number three, why are gluten-related disorders on the rise? I get this question quite often. Why are more people allergic or sensitive to gluten? Is there better scientific testing? Is there new tools that have developed to identify this problem? Or is it something else? We're going to see why. Number four, what is the best way to test for gluten-related issues? Number five, when going gluten-free goes wrong. Not everyone that goes on a gluten-free diet notices tremendous benefits. Sometimes there could be other foods that are connected to the immune system's intolerance, and they need to be eliminated as well. There could also be foods known as cross-reactive foods, which we'll cover in a moment. Number six, what to expect when going gluten-free. You should have a realistic timeline and realistic goals on correcting the damage that's been caused by gluten. So we'll talk about some of those things as well. So let's get started. First, what is functional medicine? Functional medicine practitioners are dedicated to finding the underlying cause of chronic disease and illness instead of simply treating the symptoms. Functional medicine practitioners can be chiropractors, such as myself. They can be naturopaths. They can be medical doctors, osteopathic doctors, even registered nurses and physician's assistants can be functional medicine providers. Functional medicine is not a degree, but it's a way of thinking, and it's understanding the body's connected in many, many different ways. Functional medicine practitioners are trained to look beyond the symptoms and address the whole person. There's a strong emphasis that's placed on diet, stress, exercise, genetic, and environmental factors, amongst other things. Functional medicine practitioners put you in charge of your health, and that's the main thing. That's one of the main takeaway messages I want you to get from this, is that we put you in charge of your health instead of relying on the system or your doctors for the rest of your life. The goal is always to put you in charge. This simple illustration shows you how functional medicine practitioners are different than traditional practitioners. Our goal is not to just diagnose the disease or the condition that you've developed, which is quite easy. Google can do that for you nowadays, but the underlying causes are what we're interested in. So these could include things like inflammation, a poor diet, which could have food allergens in it, a lack of purpose, toxic relationships, a sedentary lifestyle, low nutrient status, genetics. Sometimes it's the cards you're dealt, such as when it comes to things like MTHFR or other gene polymorphisms. Environment, of course, plays a huge role, and your self-image plays a huge role in your health. So these are the things that contribute to disease, and they're undeniable facts. How can functional medicine help those with gluten-related disorders? Through a thorough evaluation and history, a patient-specific treatment plan is put in place, which means that Mary and Jane and Jennifer will all have very specific treatment plans that are based on their specific conditions, their specific environment, their specific way of thinking, their specific food allergens and intolerances, there is no one size fits all. Functional lab testing allows us to more accurately assess the biochemistry of the patient and also food-related allergies and intolerances or sensitivities. Predictive diagnostic testing can prevent the development of chronic disease, often decades before symptoms would normally manifest. In those with celiac disease, functional medicine providers can help address the autoimmune aspects through diet, lifestyle, nutraceutical therapy, and other means of addressing the underlying cause and correcting the associated imbalances. What are the clinical signs of gluten-related disorders outside of the gut? This is a very, very important topic because gluten will affect different people in different ways, and it's very important to understand that. For some people, it might be symptoms like brain fog, joint aches and pains, which it was for me, along with the brain fog, skin-related disorders. I grew up having acne myself, thyroid-related issues, unexplained fatigue, nutrient deficiencies such as iron, zinc, and B12, infertility, white spots on the teeth and nails. These are signs of overt nutrient deficiencies, and people can have many of these symptoms and issues without digestive disorders. Neurodegenerative disorders such as Alzheimer's, Parkinson's, brain fog, memory lapses, foggy thinking, all of these things are associated with gluten. Anxiety and depression can also be associated. Cravings for gluten is another sign of gluten intolerance. And then the last thing is poly-autoimmunity. There could be many people suffering with multiple autoimmune issues, and that's known as poly-autoimmunity, which we'll talk about. So what is poly-autoimmunity? Poly-autoimmunity is when there is more than one autoimmune disease going on at the same time. Oftentimes, it's subclinical, which means it's undiagnosed. In patients with celiac disease, there is a 47% chance of having one or more autoimmune diseases going on at the same time. Common autoimmune disorders in those with celiac disease include Hashimoto's thyroiditis, which is actually one of the most common correlated autoimmune diseases to celiac disease. Intrinsic factor antibodies, which leads to B12 deficiencies despite supplementation and diet. Rheumatoid arthritis, which can cause joint-related issues. Cerebellar antibodies, which can cause brain-related dysfunction. And GAD65 antibodies, which can lead to type 1 diabetes. I'm going to put an image up in a moment, and I want you to stare at it for about 15 seconds. I want you to ask yourself, how does it make you feel? If you feel nauseous, dizzy, or if you develop a headache, or you have a really hard time focusing on the image, this could be a sign of something called cerebellar ataxia. And cerebellar ataxia is when the immune system is attacking the cerebellum, which is obviously a very, very important part of your brain. So I'm going to put this image up, and you can pause it here for a moment if you need to, but I want you to stare at this image. If it makes you nauseous immediately or dizzy or gives you a headache, please look away, but stare at it for about 15 seconds. Okay, so that should give you enough time to make an assessment of how you felt when you look at this picture. When I do a conference and I put this image up, sometimes I have to have people actually leave the room because they feel so nauseous or so sick by looking at this image for even a split second. So something for you to keep in mind. If you do experience this, then your cerebellum is being attacked, and you definitely need to see a practitioner to get this issue addressed. So how do we test for poly-autoimmunity? Cyrex Labs runs a test called Array 5, which provides predictive antibody testing to 24 different tissues in your body. Many autoimmune diseases develop subclinically and go undiagnosed for an average of 7 years. When you look at this image, what you'll notice is that a person starts off as healthy. There is some sort of trigger which sets off the immune activation. It could be an allergy, a virus or an infection, a major stress or stressor in your life that's going on. And then a patient develops what are called pre-symptomatic phases. And that phase is when there is damage going on to the system, but there's no symptoms because it can take significant damage for symptoms to normally appear. And then the patient might present with symptoms. This is known as a symptomatic phase. And during this phase is when they start complaining, even though there's been damage that's taken place prior to this symptom onset. And then the patient goes through a degenerative or deformative state where the damage is continuing to progress and in the very end stages. With predictive antibody testing, we can identify if a person has issues long before the symptoms and the deformation and degeneration take place. So very, very innovative testing that allows us to look a little bit deeper into what's going on and prevent things from getting worse by addressing them before they become symptomatic and deformative. Testing for poly-autoimmunity looks something like this. These are all the different antibodies that can be tested from a predictive standpoint. So we can look at antibodies to parietal cells in your stomach, intrinsic factor for B12, for things like thyroglobulin and thyroid peroxidase antibodies for the thyroid, for the adrenal cortex, for the heart tissue, for phospholipid antibodies. We can look at things like ovary and testis antibodies for those concerned with fertility issues, insulin antibodies, cytochrome P450 antibodies for proper liver function. So there's many, many different things that can be tested and identified prior to them becoming symptomatic and problematic. So this is a great array for those of you that have a confirmed diagnosis of autoimmune disease such as celiac disease or Hashimoto's to get done. So why are gluten-related disorders on the rise? One of the reasons could be GMO foods altering our gut-associated lymphatic tissue and our gut microbiome. When we genetically engineer foods, we typically do that with certain types of strains of DNA. And keep in mind, our gut is mostly made up of bacteria, and bacteria interact with our food. So changing and incorporating DNA into our foods changes the way our gut functions as well as our immune system. Chronic high stress is another major cause of GI-related issues, and it thins the lining of the intestinal tract and suppresses the immune system. The hygiene hypothesis, and this has to do with how clean we are. We're an overly clean society, and that kind of works against us because our immune system is designed to attack invading pathogens and mold and fungi and parasites. And if we don't have enough of those things coming in, then the immune system starts attacking our own tissue. Wheat is also hybridized to contain more gluten, which means we've bred it with specific strains to increase the gluten content. And this is great for the industries and great for food texture, of course, because gluten does give food its texture. But keep in mind that 50% increase in gluten has taken place over the last 50 years, which is kind of scary. And this leads to new proteins in the body, which it has never seen before. Gluten deamination, which is something that allows for longer storage of gluten, also predisposes our immune system to having to attack the new proteins that are created. There's also something known as enterotoxin contamination due to longer storage periods. Keep in mind that wheat and other commodities are sold when the price is right. So you could have wheat that's been sitting in a storage container or facility for many, many months before the timing is right to sell it at the highest price possible, and that can become contaminated. Leaky gut syndrome is another consideration where the enteric lining and the sacred barrier has been compromised. Now foods, proteins, pathogens, parasites, all kinds of stuff that shouldn't be entering into the bloodstream start entering into the bloodstream. And then of course poor nutrient status. So if we don't have good healthy nutrient status, our body can't function at its best. And what we're also seeing, and I see quite a bit clinically, is enzyme insufficiency. We need adequate enzyme activity to break our food down. When undigested proteins enter into this part of the intestine where foods should be properly digested in the small intestine, that leads to problems, inflammation, and also provides substrate for the wrong type of bacteria to grow in. As you know, gluten-related disorders are a spectrum of destruction. So I want to show you a picture of a healthy gut versus one that's completely atrophied. So on the left, what you see is something that looks like a shag rug. On the right, what you see is a gut that's been completely destroyed by something like gluten intolerance. This is a celiac patient. So imagine this. It can take some time for somebody's gut to look like what it does on the right. So damage can take place over a period of time. You don't go to bed looking at your gut looking like the picture on the left and then wake up on the right. This is a progressive destructive disorder that takes place. So it's important to use the right testing to identify what's actually causing the problem earlier rather than waiting for complete destruction and identifying the problem later on. What are the best ways to test for gluten issues? The gold standard remains complete elimination of gluten and cross-reactive proteins for at least 8 weeks. Remember that this is a spectrum, and so you could be on the left end of the spectrum where there isn't much destruction taking place, and you could even have non-GI related issues, which means you could miss, or your doctors could miss, the actual problem if they're just doing biopsies. Genetic testing such as HLA-DQ2 and DQ8 can determine genetic susceptibility to gluten. A biopsy can be done to diagnose celiac disease, which again is an end-stage disorder, which means if it's earlier in the stage, you won't get the diagnosis. Cyrix Labs, in my opinion, provides the best lab testing for gluten intolerance and sensitivity, and it looks at all the different components of wheat. It looks at the 12 proteomes of gluten, not just alpha-gliadin. Gliadin antibodies are only present 47% of the time when somebody is gluten sensitive. 53% of people are misdiagnosed based on just testing gliadin. So let's look at this image really quick. And what you'll notice is that there's many different forms of proteins and enzymes and peptides that are produced by the wheat plant. The one that's most often tested is the alpha-gliadin 33 mer, which means the other 11 are completely ignored or missed. Proper diagnosis involves looking at the immune response to the complete structure of wheat, not just one component of it. Here's an example of somebody who had an array 3 test done. If you look at their IgG and IgA reactivity to wheat, it was actually within normal ranges. If you look at the alpha-gliadin 33, that was also within normal ranges. And then you come and you look at the glutamorphin and prodynorphin, and you can see that that was through the roof. So under traditional testing, this person's gluten sensitivity would have been completely missed. But with a more comprehensive test like Cyrix Labs Array 3, we can pick these things up. So let's talk about when going gluten-free goes wrong, because not everyone on a gluten-free diet notices tremendous benefits or immediate benefits. Going gluten-free and eliminating hidden sources is very critical to those with celiac disease and sensitivity. So that's the first step. But what if you do that and you don't notice a difference, or you don't get the difference that you're expecting to get? So despite going gluten-free, many will continue to experience unresolved health issues. About 33% of people who think they're gluten-free actually aren't. But for those of you that are, you may still experience unresolved health issues. And some may revert back to a non-gluten-free diet due to limited results. So therefore, they realize, okay, this isn't working for me, so I'm just going to go back to eating wheat because I love it so much. So it's important to consider other allergens that are also cross-reactive to gluten-free grains and dairy. We'll talk about that next. So what are cross-reactivities? Cross-reactivities are when the immune system mistakes a protein such as the casein protein for gliadin. Therefore, it initiates an immune response, a dysfunctional immune response. And in this case, what you'll see is that the gliadin fits into the gliadin antibody. Casein also fits into that gliadin antibody. But you look at something like sweet potato, and it doesn't because there's insufficient binding structures. So this is where you could be consuming a gluten-free diet, and casein, which is found in milk protein, can be the problem. And so you don't get the results because your body thinks and is cross-reacting to casein. So a cross-reactivity test looks something like this, and this is an actual case from my office. And what you'll notice is that this person did have a strong reaction to rye, barley, spelt, and Polish wheat, but also look at their reaction to cow's milk. Cow's milk, casein, casomorphin, milk, chocolate, and also whey protein and oats were highly reactive, as well as millet, soy, and egg. She also had milder reactions to amaranth, teff, and corn, which are typical in a gluten-free diet. So putting this person on a gluten-free diet, and if they're still consuming things like oats and dairy and millet and soy and eggs, guess what? They're going to feel terrible. They're not going to see the results. And in some cases, they might even feel worse because now they've introduced grains that they never ate before or were in limited quantities in their diet, such as amaranth and teff. So it's important to keep in mind that cross-reactivities can be a hidden cause of continued symptoms despite a quote-unquote gluten-free diet. So what should one expect when they go gluten-free? It can take about a year for the lymphocytes in the digestive tract, in the lining of the digestive tract, to be completely retracted. So it takes at least a year for that to happen, and in some cases a little bit longer depending on other factors. Ingestion of even small amounts of gluten can cause inflammation for up to 8 weeks. So I know it's tempting to indulge, and it was for me. Trust me, it was. But it can last for up to 8 weeks. So just keep that in mind. It's not transient. It's not temporary. You don't just poop it out. It's 8 weeks of inflammation that you have to potentially deal with, which can set you back quite some time. You'd really need a multifaceted strategy to correct the damaged gut. And that could include things like vitamin D, bovine colostrum, IgG, which can be made dairy-free, glutamine, zinc, and other things can be very important. Getting tested to identify nutrients you're missing can also help promote and heal your gut. Glutamorphins and prodynorphins can lead to withdrawal symptoms and depression in some people. So glutamorphins and prodynorphins can create an opioid-like effect, and these are found in wheat, which means that people will crave them. And just like any other drug, because they bind to opioid receptors, there might be potential withdrawal symptoms associated. So in conclusion, celiac disease and gluten-related disorders can lead to a complex spectrum of health-related problems, as you've seen. Many of the common diagnostic tools used today may lead to underdiagnosis of gluten-related disorders. A comprehensive, predictive, and patient-centered approach provides the best clinical outcomes. Those with celiac disease should strongly consider the possibility of poly-autoimmunity. Those on a gluten-free diet should strongly consider getting tested for gluten cross-reactivities, especially if they want the best results possible. Once on a gluten-free diet, you must have a realistic timeline and consider therapeutic interventions to accelerate the healing time of the gut. So I want to thank you for joining me, and for joining me I want to provide you with a couple of free gifts. One is my article, Are You a Glutton for Gluten? And this will go into more detail and provide you all the clinical references that you need for your doctor perhaps to get the right testing done. So we've got 126 clinical peer-reviewed references about how gluten can be so damaging to your body and the right testing that needs to be done to correct the underlying issues. The second gift I want to offer you is my cookbook, which is called Doctor's Orders. My wife and I wrote this cookbook to help dispel some of the myths about going gluten-free and make the transition to going gluten-free much easier. These are all dairy-free, gluten-free recipes. They're also vegan as well, but you can add meat to many of the dishes if you're not a vegan or a vegetarian. You also have a recording of this talk, so I want you to watch this many times if you need to, and share this with other people, because just as you've benefited from going gluten-free, many others would benefit as well. So I applaud you for joining me, but I really want you to share this with other people because many, many people need to know this. To contact me or to contact my office, please visit our website at www.livingproofinstitute.com. My personal email address is drpatel@becomeproof.com. For more information, we're happy to help, we're happy to assist you and guide you on a path towards better and greater health. Thanks again for joining me, and I hope you found this information valuable. And once again, please share this with other people. Millions of people are suffering because they don't know this information and they don't know where to get it either. Thank you so much.